Hello, we're here today to listen to Gillian Donald and Wendy Fraser from the Dementia Liaison Team, and they're going to talk everyone through the Angus Dementia Liaison Team referral form for care homes in Angus. And I will hand you over to Gillian and Wendy.
Hello there, Gillian from Dementia Liaison Team. So today, as Ivan said, we're going to discuss our current referral forum. Firstly, I think I need to emphasise that when you do start completing this referral form, the individual needs to have a diagnosis of dementia and they need to be in full-time care. Our referral form has recently been revamped for the last few months now, but we do find sometimes that they are getting sent in not fully completed. So I think today's session hopefully will help with this. So what we're saying is it needs to be fully completed, and what I mean by that is, as well as completing the 2 pages, we want to, dependent on the individual, to maybe have ABC charts alongside this referral form. There might be dietary charts, sleep charts, etc. So it's just any more information that you may be able to give us, the more the better, and that would be much appreciated. So I'm going to discuss the front page of our referral, and as you know, it's set up as a flow chart, and this is really just to exclude any possible physical or medical issues. So really, what the first question we would be needing to ask is, has the behaviour just changed recently? Has it been a very rapid change in presentation? So we need to stop and think, is this possibly a delirium? So we want to ensure that we're not going down the wrong path. We don't want to assume that because they've got a diagnosis of dementia that this is a further progression in their illness. It could possibly be that there might be something physical going on. So for example, it could be an infection. So what we're saying here on the first sheet is we want to rule out that there's not any infection. So maybe dip the urine, just make sure that there's nothing nasty in the urine, making sure that they're drinking plenty, that they're not dehydrated, they're not constipated. One other question that Wendy and myself will also ask is, when were the bloods last done? Generally, bloods are done on a yearly basis, on birthday bloods they're called, and sometimes they get done more often depending on what physical illness they might have, for example, diabetes or thyroid problems, etc. We also would like to know, to rule out again delirium, is that have you had any recent medication changes? Has the individual either had an increase in medication, or has there been any recent reduction in medication? Because that also could be contributing to that change in behaviours. So it is important. It might be a small change in medications, but that's important for us to know. We also want to look at the middle column. This would be excluding physical causes. So, and that is looking at any unmet needs that maybe could be contributing to some of these physical causes. And I think one that often crops up is pain. Pain can be overlooked quite a bit, and that maybe they are presenting the way they are because they aren't able to express how they're feeling. So to exclude that from our little detective list, we would advise that you complete the Abbey Pain Scale tool at varying times in the day, just to make sure that there's not any breakthrough pain or there's any physical pain from something else that's going on. It could also be that, as it says in the list, it might be that they're hungry. So I think if there was concerns about diet, that we would maybe be looking at, what is their current dietary and fluid intake? So as I said earlier, that might accompany the referral form as well. So it's given us, again, a clearer picture of their current dietary and fluid intake, because that's really, really important. Because if people are hungry, then they're going to be they're not going to be happy, and they're going to be a bit more unsettled, and that's going to lead to constipation. And I do know that sometimes bowel charts are hard to complete, because some people do go independently, but that is one question we also like to know, is are the bowels moving properly? So we want to make sure that they're not toxic in any way. And finally, in that middle column, again, just excluding everything, is looking at the sensory impairment. So what we would be asking is, do they wear glasses? Are they reading glasses? Or are they just for long or short distance? Are they wearing hearing aids? And are the glasses and the hearing aids working properly, or are they wearing the correct pair of glasses for the correct task at hand? Making again sure that the hearing aids are in good working order, just to address sensory impairment. Finally, in the last column on your first sheet, you'll see that we want to exclude environmental and other causes. We need to reflect on your current working environment, your care setting that you're working in. What we would be looking for, Wendy and myself, we'll be trolling through your day-to-day nursing notes, looking at documentation that's in place, and that being the This Is Me document. We're wanting to look at that person-centred care. We would also be looking at the care plans, making sure that they're being regularly updated to ensure continuity of care, to make sure that everybody is sort of carrying out the same task that is working well, and sharing that good working practice. I think also as a team we look at making sure that staff are being regularly trained and they are understanding the illness that they're working with, and the approach they are taking is being done appropriately. We would also be, as a team, looking at, are there any triggers in your current care home setting that are maybe possibly contributing to the current behaviours, and that being stress and distress. I think when we're working in the setting day in and day out, sometimes we need to stop and reflect and look at, this maybe is possibly causing some distress for that individual. And this could be, for example, are there particular times in the day that your environment is really, really noisy? Are there particular residents that clash with one another? Is your care home dementia friendly with good signage, for example? Is somebody needing the toilet, or they don't know where to go? And another big factor is, does your care home actually offer social stimulation? Have they got activities on offer on a regular basis to ensure they have purpose to their day? This is really, really important because boredom is a big factor. If you have nothing to do, then you are going to be more unsettled. So that could be possibly a trigger for a more unsettled presentation. So having discussed these three columns, it would only be after we have worked through this front page of the referral that we would then decide, or you would decide as a care home, if you required our input from Angus Dementia Liaison Team. That would be after maybe consultation with the GP, if you need bloods done, things like that. But we are only a phone call away. I'll let you go over to Wendy now. We'll explain page 2.
Page 2 of this form, it's quite simple. The front page is a reference for yourself, just to make you sort of think of, as Gillian's saying, things like delirium, the environment, pain, things like that. The second page is a lot more specific. So at the top of the page, there's diagnosis, type of dementia. Sometimes care home staff won't know what type of dementia it is. That is not important as long as there is a dementia diagnosis. And it being at the very top of the page, this is often missed. The first box that we asked you to fill out is, what is the current difficulties that the resident is experiencing? So in this box, we're looking for signs and symptoms, any specific time that these behaviours are happening, the duration, the frequency, and the intensity of the behaviours, and what difficulties this is coming across as. The easiest way to document all of this is on the ABC format. And this helps us build a good picture of the person. What you have to remember is we don't know this resident is yours. We're only becoming involved with an opinion and using our expertise to assist you to find an answer, to find the best way to manage, this concern. So always remember that the person that you look after, that you nurse, you know them much better than we do. So you just have to give us all the relevant information possible that you can. The second box is what contributes to this resident's current difficulties. So at this is what we're calling triggers. So that reflects back to the first forum. We're looking, is it physical? Is it environmental? Can there be other causes? Again, this is going to take into consideration your pain, your hunger, your constipation, boredom, and sometimes inflexibility of the routine of the care home, staffing levels, continuity of the same staff looking after the people, because it's your resident, you know them best. And again, looking at the noise levels, is it more noisy after tea time? We refer to that as the sundown effect. So all this information will go onto that box. And again, this is the kind of information that will also be on your ABC charts that you're going to send in with your referral form. The next box is what maintains this resident's current difficulties. Basically, what keeps the behaviour going. Again, it's looking at physical and environmental issues. But this is a very good box. This is your document. This is me. This is or your storybook, whatever name you tend to call it. And this is telling us about the history of the person. We can get a lot of information from the history. Were they a night shift worker? Is that possibly why they don't sleep at night? Or were they a milkman? Were they getting up at 2 o'clock, 3 o'clock in the morning? So looking back in the person's history can help us build a current picture of their stress and distress behaviours that they're displaying just now. Also, you will have a very good relationship with the family. Families are a wealth of knowledge. So, we will work with families as well, but you also know the family, so you can get a lot of information from families regarding this. And we can't stress enough the fact that you need to use your person-centred knowledge of your resident, because you know that person best of all. You know what's normal and you know what's not normal for this person. And the next box is the resident's history. And then this is tied in with the other box, and this is me. So this is their previous employment, their personality, their characteristics. It gives us some information about their family, family members, and the relationship they have with this family members. And significant life events is also very important. And if you can, past medical history. And this is at the point that we would like, if possible, the MARS sheets that you're currently using to come with the referral form as well. Because when we get a referral form, the first part of our job is to become detectives. We will use all the clinical tools that we have at our disposal. We can go into past medical histories, we can see what current medications and things like that. So if we have all this information with us on this initial referral, it's going to cut down a lot of our research that we have to do prior to when we can come and visit you. So it's going to speed up the process and speed up the assessment process, and it basically means that we will get to you a lot quicker because all this past history is already in place for us. The last and final box is what helps reduce the impact of the current difficulties. And things that we're looking for there is, do they respond well with certain staff? Is it a male staff? Is it female staff? What is their approach? Do they use a validationary approach or a reality orientation approach? Is it contact with certain family members or certain friends that can help calm the person down? And Other therapeutic approaches that you use, distraction, things like that, do you find that these work, or they don't work, or they work for some people and don't work for others? This is the information that's very good for us. And also, do they have any, this is the PRN, as required medications? Do they make a difference? If so, how long does this medication take to work? And how long does this medication take to take effect and afterwards? And again, we'll go back to activities and hobbies. You know, what do they fill their day with? Do these distraction of sitting down with a cup of tea or sitting looking at a picture book, do these make a difference and impact on their stress and distress behaviours? But all this information will be hopefully on the ABC charts that come in with the referrals. And when we come to do our initial assessment visit, you know, we will go through this referral form with you and we can discuss as a team, because it is going to be a team. It's us and you. We work together as a team to find a solution for the stress and distress behaviours that are being displayed. Is there anything that you want to add, Gillian? Oh, one last bit before I forget. The very last bit of the box is, has anybody spoken to the power of attorney or guardianship about this referral? That's important for us to know, that the person that has legal responsibility for your resident is aware of this referral. So they feel free that they can approach us and we can approach them, and it all just makes the whole process a lot more transparent.
I think finally, just all I would like to add is that both Wendy and myself work as a team, and we're always just a phone call away. It could be that maybe it's just a little discussion over the phone. There might be no need for a referral to be completed, but we are always just a phone call away. You agree, Wendy? Yeah.
Totally agree with that. You all know the number, just to give us a wee phone, or next time we're in your specific care home, and just pop in and just say, do you want to come and have a wee talk about this person? We're a resource for you, and our aim is to all work together to make, you know, the residents' time as less stressful and distressful as possible. And that's our role.
That's our aim, yeah.
Thank you very much for listening.
Goodbye.
Goodbye.